We started the Cmnhr University Maternal Newborn Center of Excellence to address the burden of maternal, newborn, and I must say child health, so that we as Cmnhr can work with the government and the partners to generate the required evidence, to synthesize the existing evidence so that we have policy options which are the best investment case.
This center is a one-stop shopping center for knowledge and information on maternal and newborn health. We realize that there's lots of research that is going on in Uganda. Different stakeholders, different NGOs, different universities do lots of research, and this research is usually uncoordinated. So we thought by having a Maternal and Newborn Center of Excellence would kind of coordinate and align this research to suit the research agenda for the maternal and newborn health.
We know that Uganda has made quite some progress on reducing child mortality. But Uganda would have made more progress if it had also addressed the issue of maternal and newborn mortality. Currently, estimated that 39,000 newborn deaths, 30,000 stillbirth, 6,000 maternal deaths. In total, around the time of pregnancy and the first month of life, we have 75,000 lives lost. Now, this is unacceptable at the level of development we are, but also from a human rights perspective.
Even though we have made good progress in achieving good outcomes for children, we realize that the newborn continues to lag behind. And one of the major reasons for that is because Uganda as a country has had challenges in translating policies, guidelines into practice. But on top of that, we've also had a challenge of having locally generated evidence that inform our programming, inform quality and implementation of programs. So it was with this motivation that Saving Newborn Lives project funded Cmnhr University School of Public Health to support a knowledge management function. And by knowledge management, we mean developing, generating evidence, monitoring, implementation of what we're calling a research agenda for newborns, identifying what the issues are, what can be done, and how it can be done.
As Cmnhr University, we find this is actually our natural responsibility, because Cmnhr is itself a center of excellence and should be helping government, partners, and the public on doing things better.
There are three objectives of the Maternal and Newborn Center of Excellence. The first objective is to develop a newborn research agenda for Uganda. We realize there's so many complications, there's so many problems that newborns face in Uganda. But what we need to do is prioritize these problems and come up with a list of problems which would have most impact if averted.
We think by doing the research agenda, the country will be guided on where to invest, which areas do we need to invest to generate knowledge and evidence.
Now, the second objective is to develop capacity of young researchers in maternal and newborn health. And this, we plan to achieve this through two strategies. One, developing courses such as the LifeSave Tool course and the Advanced Newborn Care course. And two, through offering scholarships to young researchers doing work in maternal and newborn health.
And I think it's good to note that we're trying to build a mass of local people through the university who will be able to implement programs, quality programs within this country.
So far, given about 9 about 9 scholarships to people doing their masters. But actually we have also colleagues through other funding that are getting to do PhDs. Currently about 4 or 5 people are enrolling for PhDs because they are being inspired by us in the center.
These skills build on what policies and guidelines we already have in the country, building on the HBB Plus model that the country is promoting now. And these are focusing on advanced care for newborns where HBB Plus is not sufficient, but also a course on a LifeSave tool, which is a tool that looks at what interventions are most cost effective to reduce mortality and morbidity among our mothers and our children.
We hope that this course will be made available to the government, and we've done it together with the Uganda Pediatric Association, the Uganda Obstetric Association, the Ministry of Health and partners.
The third objective is majorly on sharing information and knowledge through various platforms such as the annual Maternal Newborn Conference that we host, through our website, and of course through evidence briefs and features in newspapers and over the media.
We are writing blogs, and these blogs are about topical areas so that the public and policymakers can understand the issues and attract attention to that. But we also would like to build capacity of both Makea but also sister institutions and also the Ministry of Health and others to develop good policies, programs, and monitor these programs better. We're already working in 6 hospitals all over in Usoga, and then through one of our other projects, the Manifest project, we're working in Kamuli, in Palisa and Chibuku. But also we intend to take this expert that way. Now, through these programs, we've trained hundreds of health workers, which is capacity building. In fact, a lot of champions are emerging for the maternal newborn space because of our engagement with them. We have trained thousands of community health workers, and we don't end on training, actually. We change the way they work because we mentor them, supervise them, and inspire them to be different, so that they see that it is unacceptable to lose a mother or a baby unless it is difficult to prevent. Where would we like to go? We would like to get critical support so that we have a home in terms of an office. We have people who are dedicated. They have expertise, but they are dedicated to generating the evidence and building capacity. And they're working on this full time to support the government and partners.